Welcome to Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan-Blythewood.
Good day, everybody. Thank you so much for joining me today, and welcome to Black Health, a platform to discuss illnesses affecting the Black community. I am your host, Dr. Michelle Kirwan-Blythewood. I am a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami, Florida. Today, we are talking about bipolar disorder, and joining us to do so is board-certified psychiatrist, Dr. Delvena Thomas. Dr. Thomas is a mother, soldier, scientist, and physician, and a champion for sound mental health. Trained in medicine and psychiatry at the University of Maryland in Baltimore, she is board certified in psychiatry, neurology, and maintains a private practice in psychotherapy, psychopharmacology, and alternative health. She created her own show, Therapy Thursdays, and is the author and producer of her own podcast, the Brain Love Podcast. You can find her latest mental health books on Amazon titled Brain Sleep and Brain Food. She is also co-host for MIA Media's group Soul, which is a weekly entertainment show about fashion, arts and culture, relationships, and mental health. Dr. Thomas, you're a very busy woman. Welcome to the show. Thank you for coming back again. You've been a guest before with us.
Of course. Thank you, Dr. Curran. Thanks for having me. Oh, Blythewood, pardon me.
It's Blythewood. There's actually no L in there, contrary to...
Blythewood, pardon.
Yes, it is actually Blythewood. I do still go by Dr. Kirwan for medical purposes. It gets very confusing. Okay. But anyhow, we're not here to talk about me. We're here to talk about bipolar disorder, which I find is a very interesting disorder, a very interesting topic, and I think one that really needs some discussion. I think we don't talk about it enough, and we maybe don't realize how prevalent it is. So let's start with what bipolar disorder is. What is it?
Sure thing. Yep. So bipolar is a mood disorder that causes folks to experience highs and lows. That's really the easiest way to describe it. And that's what most patients will describe it as, high and low. You'll also hear people say manic depressed. So it means that someone is experiencing symptoms at both ends of the mood spectrum, if you will. When we think about our mood, oftentimes people are aware of sadness and depression, but when folks overshoot or they have a mood that goes over and beyond being content or being in the middle, they're either super happy, which we call euphoric, or they're angry and irritable for no reason at all. Then you start to think about bipolar disorder or someone who's experiencing two moods. That being said, if someone has bipolar type 1, because bipolar has many different variations, if they're bipolar 1, they might experience the highs only and never have had a major depressive episode. So bipolar gets pretty tricky, and it can be a little complicated, or shall I say very complicated, because there's a lot of different forms and they present differently.
Okay, very interesting. So how prevalent is it in the Black community, bipolar disorder?
It's not any more prevalent than it is in the majority. The incidence of bipolar is the same amongst African Americans as it is in the rest of the community. So it's not any more prevalent than the other ethnicities or the other racial groups. So when someone is manic, you cannot talk to them, you can't interact with them, you can't engage them. They are so off the chain, may I say, that typically they're talking very fast. They're very difficult to interrupt. We call that pressured speech. They may also be very grandiose. They feel like they can do many things, that they might have these superpowers that they, which makes them agree to taking on certain responsibilities that they can't handle. So maybe someone asks them, hey, can you make 100 cakes for me next week? And because they're manic, they're like, yeah, I'll give you 100 cakes and 200 pies and, all this extra stuff. Many times they're not sleeping at night, but they're not tired the next day. They make poor decisions. They might decide to spend a lot of money, although they don't have it in their budget. Sometimes they'll be hypersexual and they're not careful. They might not use protection, condoms, these types of things. And They make impulsive decisions. They're not able to stop and reason and think things through before they make a decision. So those are the usual type of symptoms that one would see, along with the fact that their mood is super elevated. They're very happy for no reason at all, or they're irritable.
Okay. We actually do need to take a commercial break. So you are watching Black Health. We are on today with board certified psychiatrist, Dr. Delvena Thomas, and we are talking about bipolar disorder. And don't forget, Black Health is brought to you by the Health Foundation of South Florida. We will be right back. Don't go anywhere.
At Baptist Health Orthopedic Care, you don't have to be a pro athlete to be treated like one. We use the latest techniques to give you an accurate diagnosis, along with surgical and non-surgical solutions, no matter who you are. Our team of specialists will do everything to help you perform at your best again. And with personalized recovery and rehabilitation plans, you'll be back to living your life to the fullest in no time. Welcome to Pro Level Orthopedic Care.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Miami-Dade, we have an important choice this year, who we elect as our sheriff.
It's been 60 years since we elected this position, and the choice is clear for me. I'm with Chief James Reyes.
I'm with Chief Reyes too, because he understands our community and is the most experienced to keep our neighborhoods safe.
Chief Reyes has a plan to take on public corruption with a dedicated unit to deliver accountability for our community.
This August, join us in voting for Chief James Reyes.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
Hey Miami-Dade, the August 20th primary election is approaching. Register to vote or change your political party online or by mail no later than July 22nd. Visit miamidade.gov/elections or call 311.
The August 20th primary election. It's your voice and your vote, so make it count. Request your vote by mail ballot before August 8th. Easily track and confirm your vote online. Take action at miamidade.gov/elections or call 311.
Welcome back to Black Health, brought to you by the Health Foundation of South Florida. We are talking about bipolar disorder with Dr. Thomas, if you're just joining in. Dr. Thomas, you started to talk about the different symptoms, hypomania, hypermania. How is it diagnosed? How is it diagnosed in adults, and how is it diagnosed in children?
Sure. Yes. So I was just explaining the symptoms of mania. Those manic symptoms can last for, sometimes they're 3 days, sometimes it's 5 days, sometimes it's 7 days. But if they meet criteria, they have all of those symptoms, then you would diagnose mania. So it should be at least 3 days, but sometimes, I've seen in different references, we have a Bible, the DSM-5 TR, and our DSM-5, it says 3 days of these symptoms, but I have also read on other sites and with other reputable references, they'll say a week of these symptoms. So, and the hypomania, which I didn't get a chance to talk about, but it's everything that I described for mania, but it's a lot less severe. It's not as bad. And so with bipolar 1, they have this manic episode. They may not ever have a major depressive episode, but with bipolar 2, which is the other type of bipolar that's less severe than bipolar 1, they don't have the manic episodes, they have the hypomanic episodes, but they have experienced the major depressive episodes. And the definition of a major depressive disorder or a major depressive episode are symptoms that last for 2 weeks or more. And those symptoms are intense sadness and or loss of interest in things that they typically like to do. We call that anhedonia, changes in appetite, changes in sleep, and those changes could be increase or decrease. So it doesn't have to be a decrease in appetite. It could be an increase of appetite. The same with the sleep. It might be they're not sleeping, or it could be they're sleeping all the time. They might notice that they can't concentrate, that they have low energy, low motivation. They may also notice that they're isolating a lot and they're thinking about dying, or they're thinking about not being here. They become a lot less engaged. And some people become hopeless and helpless. And in men, when they're depressed, we see that they're irritable, and oftentimes they have a loss of interest in sex. We see a reduction in their sexual appetite, which of course you can see that in both sexes, but men present a little differently with their major depressive episodes than women. You asked me about children. Children will experience some of the same things. They can experience the major depressive episodes. They can experience the mania and the hypomania. So the time period is similar for both.
Is there an age at which you can diagnose bipolar for children, or an age beyond which you are still watching, or what's the youngest?
I have seen children diagnosed with bipolar as young as 8, 9, 10. So there's nothing in the criteria that states a child has to be this age in order to render a diagnosis of bipolar. If they meet the criteria, if they have the symptoms and they meet the timeline of symptoms, then you make the diagnosis. There are some other ailments and illnesses in psychiatry where you don't diagnose it until that person is at least the age of 18, but bipolar is not one of those things, and neither is schizophrenia.
So in my practice, I sometimes have parents, one or the other might be bipolar. And when they start to see certain behaviors in their children, typically it's the parent that's not bipolar that is starting to get worried. Are they taking after their father, for example? So is there a genetic component to bipolar disorder?
Absolutely, yes. Absolutely. And when you go and see someone to have a psychiatric assessment, if they don't ask you, that first appointment should be at least an hour or sometimes 90 minutes, because you have to ask that professional has to ask the patient questions about every sphere in their life. And one of those spheres would be the family mental health history. We ask, does anyone in your family have a history of schizophrenia? Or has anyone ever been diagnosed with bipolar? Has anyone ever been diagnosed with a severe depressive illness? We also ask about suicides in the family and alcoholism, because all of those things that I mentioned, they all have strong genetic linkages. You see a lack of insight in folks who have serious mental illnesses like schizophrenia and bipolar. So that makes it very difficult, because oftentimes people don't want to stay on medications, or they play around with the medication. Some days they take it, some days they don't. And our medications don't work that way. You have to stay consistent with the medication so that you maintain the blood levels. We use mood stabilizers, and at times we use antidepressants. Back when I started training in psychiatry in 2003, 2004, the clinical practice guidelines endorsed highly using a mood stabilizer and an antidepressant. And then studies showed, hey, don't give someone with bipolar an antidepressant, just give them mood stabilizers. So mood stabilizers could be things like what we use for seizure disorders, things like Depakote, Lamictal. We also use things like Trileptal and Topamax, Tegretol. So those are the classic mood stabilizers. And then we have some atypical mood stabilizers that we use, which can also be used for things like schizophrenia and psychosis or severe major depression. That would be medications such as Seroquel and Abilify and Zyprexa. And then, sometimes if someone they have experiences with severe depression or they have major depressive episodes, you have to give them an antidepressant, because it may not be enough for them to be on that mood stabilizer to prevent them from getting depressed or going low. And it may not be enough to pull them out of that depressive episode if you just give them a mood stabilizer. Lithium is another great medication that is very effective for manic episodes as well as severe major depressive episodes. And lithium can be used in people who only have unipolar disorder, which would be major depressive disorder. So, and then besides the medication, psychotherapy help a lot and a lot of
That's my
education.
next question. Yeah.
Absolutely. And you need a doctor who's going to explain and talk to you and help you work through these episodes. I have very functional people, patients who I see who have bipolar. Some of them are athletes, some of them are teachers and educators, some of them are lawyers. The fact is, people with bipolar can be very high functioning and can be very successful people, because those manic episodes, if they, I don't want to say this improperly, but if they use that not sleeping to be productive and to get done and to create projects, there's some artists and some painting artists, as well as some singers and celebrities, Kanye West to name one, who have bipolar. And I'm pretty sure he probably functions the best when he's manic. And a lot of times people like being manic, especially when they're manic, they're happy as opposed to being angry, and they're productive.
Wow, that's very interesting. Are there any lifestyle changes that an individual can use to manage their symptoms more effectively?
People stay off of the cocaine and the cannabis. If you have bipolar, don't use cocaine. It's a stimulant. It's going to hype you up. It's going to probably push you into a manic or hypomanic episode. If you smoke cannabis, it's probably going to make you apathetic, which feels like depression for some people. So could keep them cycling into what feels like depression for them. Drinking alcohol is another thing to refrain from if you have bipolar. Not only are these things interacting with your medications, as well as cigarettes interact with our medications and make them less effective, because maybe we're metabolizing them very fast and pushing them out of the system. So the first thing is to get rid of all those substances and to eat healthy as possible and to exercise on a regular basis. I would recommend those things first.
And how about managing relapses? I imagine that happens quite commonly. Is there anything in particular that is done, or just getting them back on their medication and regulated again?
Back on the medication, getting them some sleep. That is a big source of help, or can be very effective to break a manic or hypomanic cycle, is to get them to sleep. So making sure that they go to their doctor, ensuring that if they need hospitalization, they go to the hospital.
Okay. Well, it's time for another commercial break. Black Health is brought to you by the Health Foundation of South Florida, and we are talking about bipolar disorder today with Dr. Delvena Thomas. We will be right back.
At Baptist Health Orthopedic Care, you don't have to be a pro athlete to be treated like one. We use the latest techniques to give you an accurate diagnosis, along with surgical and non-surgical solutions, no matter who you are. Our team of specialists will do everything to help you perform at your best again. And with personalized recovery and rehabilitation plans, you'll be back to living your life to the fullest in no time. Welcome to Pro Level Orthopedic Care.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
I'm your mayor, Daniela Levine Cava. 3 years ago, I made a promise to build a government that listens, responds, and innovates for the future. And we've done just that. Now my opponents are falsely attacking my record, trying to divide our community. We've cut property tax rates, we've empowered small businesses to thrive. While they attack me, I'm committed to attacking our problems with clear solutions. It's what I promised to do 3 years ago, and it's my promise to you once again. Let's continue to get the job done together.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
Hey Miami-Dade, the August 20th primary election is approaching. Register to vote or change your political party online or by mail no later than July 22nd. Visit miamidade.gov/elections or call 311.
The August 20th primary election. It's your voice and your vote, so make it count. Request your vote by mail ballot before August 8th. Easily track and confirm your vote online. Take action at miamidade.gov/elections or call 311.
Let's go to our next question. How important is it for early intervention in the treatment of bipolar disorder? And what signs should families look out for? I think you probably mentioned most of the signs and symptoms they should look for, but what about early intervention?
Yeah, early intervention is getting them to a psychologist or a psychiatrist as soon as possible to make the diagnosis. You know, there's a lot of mental health professionals out there in the community. There's master's level therapists. Those are your licensed clinical social workers, your licensed mental health counselors, your marriage and family therapist. There's also master's level nurses who call themselves psychiatric nurse practitioners. Bipolar is such a complicated disorder. I would take my family member to the highest level professional. That would be a psychiatrist to manage the medications and a psychologist for the psychotherapy. So early intervention includes getting someone to mental health care as soon as possible to make that diagnosis, which at times might include neuropsychological testing. That quite often is done by a psychologist, but there are some psychiatrists out here who conduct neuropsych testing. So an early assessment as soon as possible and making that diagnosis is important.
Very good. Well, we will try that commercial break now. Black Health is brought to you by the Health Foundation of South Florida. We are talking about bipolar disorder with Dr. Delvena Thomas, board certified psychiatrist, and we will be right back. Brain love. And moving on, Dr. Thomas, what are some common challenges that families face, effect on their family dynamic or relationships when they're trying to support a loved one who has bipolar disorder?
Dealing with a family member who has a mental illness, especially something as severe as bipolar, can be a challenge for many family members. Sometimes they don't understand the illness and they don't know how to interact with a family member who's going through the mania or the hypomania. It requires a lot of patience. It requires knowledge, gaining that knowledge and understanding how to deal with the person and how to understand their symptoms. So I would recommend that they go on sites like NAMI.org, National Alliance on Mental Illness. The American Psychiatric Association is an excellent source of information and gives many links and referrals for different family support groups. So it's important family seek out these support groups so they can talk to other family members who are going through the same situation. And just show grace to your family member and love them to death. Always love them, hug them, tell them that things will be okay. Encourage them to take their medications, encourage them to go to treatment.
Are there any disparities in the quality or accessibility of mental health care for Black individuals with bipolar disorder?
Yeah, there are a lot of disparities across the board in the medical field. In psychiatry, we know that with many disorders, Black folks are not accessing care or don't have access to care as much as the majority. So we see a difference in how Black people are able to access care. Sometimes they don't have health insurance. In South Florida, a lot of our mental health professionals are self-pay only, which really limits who can come to your practice. So there are some community mental health centers. People can go there to access care. And then, sometimes because of the cultural differences, Black folks don't feel comfortable going to talk to a majority because they don't understand the nuances in the Black community with things like our hair, for instance, the colors we wear, as another example. So those would be reasons as to why, maybe we don't access care as much as the next population.
Dr. Thomas, I believe we're coming to the end of our show. I had one question, and I think it's an important question. What advice do you have for an individual who has recently been diagnosed with bipolar disorder? Maybe advice, but also words of comfort, maybe.
Yes.
Encouragement.
Listen, you were made in God's image. You are not broken. There is nothing wrong with you because you have this disorder. It is not any different than someone who's been diagnosed with high blood pressure, diabetes, lupus. It's all under the same umbrella. It's something that your body is going through that has to be taken care of. So do not feel like you're broken because you have this diagnosis. Live the best that you can. Seek the information, power up your team with the best mental health professionals as possible, and be compliant with your medications, eat healthy and exercise, and prayer.
Amen. I love that. Thank you so much, Dr. Thomas, for joining us on Black Health today and for your wisdom and information about bipolar disorder. It was very informational, very educational, even for me as well. Brain love. Yes, we must have brain love. So thank you, Dr. Delvena, for all that you do and for your brain love work and your brain love podcasts and books and your participation on MIA Media Group Soul. We love to see you, and we always want to see more of you. So thank you again for coming on Black Health, which is brought to you by the Health Foundation of South Florida. I am your host, Dr. Michelle Kirwan Bythewood, and you can follow me on IG at Black Health Show. We will see you next time on Black Health. Have a great week, everybody.